Okay, so I think most of you know me, but for those who don't, this is Chaya Makija. I'm an endocrinologist residing in Central California and have lots of other roles, which we will talk about. But this month, February, is a heart health month. And because I deal with diabetes day in and day out, it was just a nice time to connect both those systems or organ systems and share some tidbits and some tips on how to prevent complications or prevent such diseases. So without wasting further time, we are going to dive in. So beyond endocrinology, just a background, my education has been internal medicine after medical school, and a fellowship in endocrinology, which is pretty wholesome. It has diabetes, all the hormones and endocrine system, as well as metabolism. So how our machinery runs, is basically metabolism. And lifestyle medicine was further ahead because I felt that component was lacking in our medical education. And now I feel more complete with the background of education. But beyond that, I was very keen in creating an environment where I could incorporate both these fields, and that's where I founded the practice called as Unified Endocrine and Diabetes Care in Central California. But I welcome patients throughout our state of California. In terms of our life, other than being a physician, I also teach at our local universities. I have been our patient several times, several occasions, and I feel that has a lot of affirmations that I will be going through with you today. And being in Central Valley, I enjoy our local farm produce, which we are also going to incorporate in our discussion today. So let's go into our absolute learning objective, which is just going to be four, but enough to go over the basics of diabetes and cardiovascular system and certain guidelines, which are all American Medical Society guidelines, focusing on lifestyle intervention. We're not talking about medications or prescription drugs today, but all about simple strategies and how you could implement these for your health goals and outcomes. I will also go through certain clinical objectives that we as physicians tend to look at, which will also help you to look at the perspective from a physician's standpoint. All right, so why both these conditions? Now, I don't know how many of you are aware, but in United States itself, 34 million, it's more, these are older statistics, but 34 million or above have diabetes, and most of it is type 2 diabetes, which we are focusing again today. It has devastating consequences, and the most common reason for mortality or death is heart disease. Most of my patients, where by the time they come to see me or any other endocrinologist, they're already, dealing with complications related to the eyes called as retinopathy, leading to neuropathy, which is tingling, numbness, and even gut issues. Of course, heart disease, end-stage renal disease requiring dialysis, skin changes, and even psychological and mental health, which does get affected with this condition. Beyond that, it's also the finances. So personal and healthcare costs are in millions for the healthcare system as a whole, but even for patients, the amount of monthly expenses for drugs, for different technology, for tools, for apps, even doctor visits, specialist visits, it does impact them financially and mentally. Now, if you had to again look into simple stats, one out of three individuals. So if you were just sitting in a room with a couple of your colleagues or workplace or your friends, just keep that in mind. One in three individuals, young adults, will develop diabetes sometime in their lifetime. And 6 in 10 adults have something called as chronic disease. Chronic disease is a condition which lasts for more than 2 weeks. And the most common ones in our nation or our country are heart disease. That's number one. cancer, chronic lung disease like asthma, COPD, bronchitis, stroke, Alzheimer's, dementia. And again, diabetes is directly related to Alzheimer's dementia. Diabetes here primarily focusing on type 2 diabetes mellitus and then chronic kidney disease. So what is this diabetes mellitus? Well, it is, I would so call it as a bread and butter for an endocrinologist, but it is also very commonly seen by primary care physicians. And we all as adults should be aware of this condition so that we are reaching out or seeking for appropriate screening. So anything which leads to high blood glucose and it's prolonged will lead to a condition or a diagnosis of diabetes. We have certain diagnostic criteria, which I'll walk you through almost at the end of our discussion. Now, amongst this condition, type 2 diabetes mellitus is more common. We are not focusing on type 1 diabetes, which is more autoimmune. Now, what's happening here are two separate phenomena. One is there is inadequate beta cells. So just imagine your left side of your belly, where your stomach sits in the front aspect. Behind it is your one of the essential organs called as pancreas, and that produces a hormone called insulin. Insulin is extremely vital for our sustenance of life, and that is being produced by beta cells. Now, these gradually over time get exhausted. Most of it is dependent on our lifestyle habits. Now, the second root cause, which is the common root cause for multiple conditions, is called insulin resistance. Other than the non-modifiable, that is what we cannot change, is a family history or our hereditary background. 50% of what is in our control, so food, inactivity, including inflammation, is all going to be discussed today, which we all can address, and we have a choice and control over it. Now, for me, the reason I get involved in community discussions is just because I see younger and younger individuals with this specific diagnosis. My youngest is an 18-year-old with type 2 diabetes, and pediatric endocrinologists end up seeing patients who are 12 to 13-year-old who are struck with this condition called type 2 diabetes mellitus. Now, just to put things in perspective, 10 years, 20 years down the road, when they're younger adults, or even in their 40s, they're already struck with complications related to heart, kidneys, and their nervous system. Hence, it's very, very crucial for us to be aware of it, to go move forward with screening as well as pass on this knowledge to our near and dear ones. Now comes the cardiovascular disease, which is the heart, right? So heart and the blood vessels, that is all the arteries that are supplying oxygenated blood to every organ system.
I can't find the toothpicks.
If someone's not muted, could you please mute yourself? So as we move along, the main common problem with heart is atherosclerosis. And what that means is just a fatty buildup in our blood vessels. You could compare your blood vessels to a drain, right? So imagine you have the entire drainage system in your house or in your home that will get blocked with sticky substance. And that is what fat is. Along with that, there is inflammation, there is high blood sugar, there is high blood pressure, of course, high cholesterol, and smoking is notorious to lead to inflammation in these blood vessels. And eventually there is plaque built up, and further ahead, these could disassemble from that particular drain, that is the artery, and lead to a stroke or a heart attack. For all these conditions, as well as for heart disease and diabetes, the major root cause is something called as insulin resistance. Now, I'll walk you through what insulin resistance is just with a simple diagram. Now, if you can see my white screen here, I will be using my pen to just show you what an actual cell looks like. So we are composed of millions and millions of cells, and we tend to use glucose as our fuel. So our primary fuel or energy is a glucose molecule, and these cells take glucose, but that's dependent on insulin. All right. So insulin is the hormone that we talked about. So once insulin enters in, glucose is allowed to enter in. So insulin is working as a key to open the door for glucose. What's happening in our modern generation era and with the foods that we are taking is that we have these fatty deposits in the cells. Okay, it's called as intracellular fat. And what that does is it blocks the entry of insulin. So now there is no insulin entering, or there's minimal amount of insulin entering into the cells, and this does not open the door for glucose. This is simple insulin resistance. Now, the way I describe it is simple, but it's causing major complex problems in all our organ systems. If this glucose does not enter the cell, it's circulating in the blood, leading to high blood glucose. If this insulin is not adequately entering into the cell, it is leading to high insulin levels, and it's further damaging other organ systems. So that is what's depicted in this slide, where it talks about when we have excess intake of processed foods or high fatty foods, these eventually get break down into glucose molecules, and then the excess glucose in blood is signaling that, hey, I need more insulin, I need more keys to open those doors. But the fat inside the cells is blocking the insulin entry, leading to less entry of glucose in the cells, leading to high blood sugar, insulin resistance, and eventually type 2 diabetes mellitus. So if I had to walk you back through this cycle and take you to the culprit, here it is. All right. So it all depends on what we are fueling our cells, starting from our mouth and from our sense organs, and that is going to help us reverse this insulin resistance. Why am I focused on insulin resistance? Because it's not just type 2 diabetes. It's literally every chronic disease, every metabolic problem that we as physicians encounter, and patients, community, the nation, as well as the world, they are facing through this epidemic of type 2 diabetes, of obesity, of heart disease. So if you take a look on the right-hand side, I have the disease burden, where any individual struck with even one specific diagnosis is ending up seeing their primary care physician and multiple other specialists just to get the problem resolved or managed, or even to add on to medications and further complications. But eventually they are struck with medications, multiple follow-ups, and we forget about the root cause. On the left-hand side, what you see are the clinical features. So there must be many of you, or who you've known, your family members, your friends, or even at workplace. How often is this fatigue, weight gain, sense of depression, joint pain, achiness? I'm sure many of you might be correlating that if you have a heavy meal, you may feel lethargic or may have joint aches, or there's difficulty in recovery with aches and pains of muscles. And that is all related to the problem that I just described to you, insulin resistance. Individuals who have darkening of the skin or skin tags, they deal with infertility, especially younger females, and pregnancy complications, many of these are tied with insulin resistance. Your cholesterol level. So low HDL is low good cholesterol. High triglycerides is purely high in fat. The amount of food that we eat is directly related to the high triglycerides, and high LDL, or which is the bad cholesterol. If there is a profile of high triglycerides, low HDL in your lipid or cholesterol panel, time to get addressed, time to get that insulin resistance addressed, time to get some resolution for this metabolic disease. Uric acid, or individuals experiencing episodes of gout, is all tied in with the same exact pathophysiology. Individuals with fatty liver disease, where there is excess fat deposition in their liver, also share this common root cause or pathophysiology in medical terminology. Now, what is really happening in our bodies? This is from CDC, where it's actually a sad way to express that number two cause. I'm not looking at tobacco or excessive alcohol use, because we are aware of it for ages or for decades, that they can cause malignancies and several chronic diseases. But poor nutrition in a developed country, that shouldn't be a risk factor for chronic disease. Physical inactivity, when we have a large square surface to live, we have larger homes, we have amazing parks and national parks, and still physical inactivity remains the third more common risk factor for chronic diseases. So why poor nutrition? So let's go back to as to what's happened in our modern era and generation. You can take a look at this flow chart right here. Busy lives, sedentary jobs, more screen time, be it your laptop, your desktop, your phones, or meetings. Those are all, we are being bombarded with screen time more than just regular interactive time or in nature. That is bound to happen because our work demands so. But other than that, lesser time for self-care. So more packaged foods, more luxuries, more media exposure, more confusion as to what's right and what's not right for me, leading to issues later during the day. That is inadequate sleep, disturbed sleep, or late night dinners, all leading to dis-ease. So disease itself is taking us away from our ease. These all conditions are also termed as lifestyle diseases. So in summary, or the bottom line is that the choice still remains in our hand if we would like to prevent it, to reverse it, or just manage it with medications and with more physician visits. On the left-hand side, this is my favorite one, which I also share with our residents, that our life is so much on the go. It has become a flight and flight response every minute, every second. It's not a bear attack anymore, but our thoughts, our demands, our expectations are creating a response in our body, that is the adrenaline and the stress hormone, where we are being faced with fight and flight response day in and day out. And that leads us to missing out meals. That leads us to a sense of feeling that there's lack of energy and more caffeine intake, or more intake of high caloric foods. This all is connected to our endocrine system, which is adrenaline, your cortisol, and it is all impacting our pathophysiology, or the root cause for insulin resistance, for diabetes, and many other chronic conditions. This is a lovely picture or a depiction from American College of Lifestyle Medicine, which just shows that standard American diet is also termed as SAD, S-A-D, as simple as that. So what we are eating over time, and it's not just United States of America, but many other countries have a very high incidence of obesity and type 2 diabetes, as well as heart disease. It's just because there is more caloric intake, which is higher in fat, higher in fried foods, higher in unsaturated fats, to be very precise, leading to these conditions. And that is what is poor nutrition. So even though when you go out, you get your takeouts, the portions are large, and I usually get this from my patients that, oh, what did you eat last night? Oh, I had leftovers from lunch. Oh, I had leftovers from the previous night, right? So in terms of volume, we are exposed to a lot of food, but the nutrition is lacking, the enrichment is lacking, and the real food is actually lacking. So what's real food? On the right-hand side, if you take a look, you don't have to eat raw foods. But the point is that, there has to be more variety, less processed foods and vegetables, but more fresh fruits and vegetables, whole grains, complex grains, and legumes, lentils, beans, nuts, and seeds should be comprising most of our intake. 70 to 75% of it. And that would be giving us enough nutrition so that we can fight these diseases as well as prevent them. Now, this one is a very useful handout from American Heart Association. And if you take a look on the, I'll walk you through it. But if you take a look on the right-hand side, it's a beautiful handout where it talks about 10 ways to improve your heart health. Other than physical activity, American Heart Association also encourages fruits and vegetables, including whole grains, and healthy protein sources, mostly from plants and seafood. There has to be a very conscious effort of minimizing processed foods. Anything that is packaged, anything that is not going to get rotten sooner is probably processed. So that's an easy way to differentiate when you choose and pick foods. Subtract added sugars, right? So our fruits are rich in natural sugars, and it's not about that. It's about the added sugars in sauces and beverages, in different packaged foods, in desserts, in baking items that could be limited. Cutting down on salt. This is also more added salt, and if someone has hypertension, definitely reduce to less than 2 grams per day. But take a look if you are used to eating canned foods or anything in the jars, they're already having added salts. This is going to be very essential to improve heart health. I'm going to share some real patient outcomes and stories which would help you re-emphasize the fact that without additional prescriptions, even individuals with long-standing type 2 diabetes or any form of heart disease can actually have a better outcome in terms of their health and longevity. This is a 54-year-old male who I'd seen last year with type 2 diabetes for 17 years. And prior to that, there were inconsistent follow-ups, barely any physicians. His insulin prescriptions were coming from urgent care. And he was just dealing with frequent multiple foot infections. The day I saw him, he called me from the ER where he had an active foot ulcer and was told to find an endocrinologist to control his blood glucose, or he would be scheduled for an amputation. Now, amputation is one of the or diabetes is the most common cause for foot amputations. Now, within 3 months, this patient lost 40 pounds. He was off all insulin, which were 4 injections a day. And this purely happened with lifestyle changes and giving appropriate medications, which actually help with benefits in their cardiovascular heart disease outcomes as well as for diabetes, but all the insulin was discontinued, stopped very safely. On the right-hand side, if you take a look at the graph, these are A1C in orange circles, which is almost half of what he was, which implies that blood sugars, this was 353 when I'd seen him, but by the time he was in early this year, 97 to 110. So he's now in the pre-diabetic range just with lifestyle changes. Lifestyle changes were exactly the same. What American Heart Association talks about heart health, exactly the same would be followed by American Diabetes Association for reducing your hyperglycemia, high blood glucose. This is another success story where the patient was able to implement lifestyle changes, lower the weight, off insulin, and another impressive change was she had fatty liver disease, which was completely reversed, along with triglycerides, purely by lifestyle changes. A third patient with significant complications related to type 2 diabetes for almost 20 years was retinopathy, active bleeding behind the eyes. And she was mentioned the same thing that, it would lead to blindness if this wasn't controlled. So address the root cause, which is high blood glucose. And when she saw me, the goal is not to just correct blood glucose, but actually address insulin resistance. Same thing happened with her. And right now, she's not on any insulin, and her averages are very much close to pre-diabetes or normal ranges. So what are the simple habits? 3 simple strategies that I am going to go over in the next few slides. And these patients follow the exact same rule. Increase your fiber intake. So no matter if you have pre-diabetes or diabetes, but even if you want to prevent, this is a great first step to take. Fruits and vegetables, beans, whole grains, nuts and seeds, they're going to be your best friends when you think about food. Now, where do you start? Just think about, 2 to 3 servings of fruit a day, an apple, a banana, a few berries if they're seasonal, or any seasonal fruit that you would enjoy. Consider that as a great snack, or, add that in your breakfast, or even when you start any of your meals. Think about, beans, whole grains, but they have to be complex whole grains. So whole grain in terms of wheat, if you're able to tolerate it. Quinoa is a great option that you could opt for. Even the beans and lentils would give you enough fiber as well as complex carbohydrates. Nuts and seeds tend to have polyunsaturated, monounsaturated fats, and they would be more helpful in terms of even the fiber intake. Reduce the unhealthy fats. So where are those coming from? Anything that's processed, all animal fat, including dairy. You have to be very mindful that you are reducing those when you automatically increase your fiber intake. And this goes without saying to minimize and avoid processed foods. This is one of my favorite recipes, but the point here is why more fruits, vegetables, and why more fiber is because they are very much helpful in reducing cholesterol. And cholesterol is directly related to, the cardiovascular health. They're very rich in potassium, and that helps to reduce blood pressure. Normalizing your blood pressure is going to help your heart health. They're antioxidant rich. So they are actually helping you to fight the free radicals. And again, to simplify it, they are helping you to reduce the inflammation in your body. They're all going to help you to improve the insulin sensitivity. Gut health. You must have heard about gut microbiome, and these are extremely rich to build your own healthy gut bacteria. It should be very, very clear that, these foods don't have any fat, or they're very, very low in fat. Even yams and sweet potatoes could be a great help for you, where they are rich in fiber, and they would be lesser in fat component as compared to animal fat or dairy. But again, they should be mixed and matched with other vegetables or non-starchy vegetables. This would be a great addition to anyone with the disease, without a disease, doesn't matter, but it's just for your health and longevity. The next step, or number 2 step, which is extremely important, is your screening test. So on the left-hand side, I've gone through simple tests like hemoglobin A1C, which is helpful for diagnosis of prediabetes or diabetes, a lipid panel, a metabolic panel, which gives you an idea of your liver function tests, liver enzymes, kidneys, and electrolytes, a complete blood count to look at your white blood cell, your hemoglobin, as well as a thyroid panel. Now, others, which are also very much discussed in American Heart Association or American College of Cardiology, including with several endocrinologists who are focused on cardiovascular outcomes regarding apoprotein B, a fasting insulin. These are all blood tests, a uric acid, as well as a high sensitive C-reactive protein, which is an inflammatory marker. So you could always discuss this with your healthcare team and discuss with your physicians or whoever is taking care of you to add on to these blood tests if they find it relevant for them. Get the right medical expertise. So if you are not getting an answer as to how to prevent or how to address the root cause, then seek, search. I'm sharing some resources, but it's very important that all these medical society guidelines talk about lifestyle intervention, but at a physician's office or with a healthcare team, there's barely any time to review those except for discussing prescription drugs. For my patients, I also add on to certain parameters like looking at the waist circumference, which is also very well studied for metabolic syndrome, a body mass index using a body composition machine, but it also varies because individuals may have higher muscle mass, which is actually good, and they may have an elevated BMI, but that's healthy. Visceral fat is the fat surrounding the pancreas, the liver, and that is also determined through a body composition, which is also directly correlated with insulin resistance. For your reference, I have attached a link to something called as atherosclerotic vascular disease risk calculator. And this is very, very helpful. Again, as physicians, as endocrinologists, as cardiologists, it's commonly utilized where we enter age, gender, ethnicity, as well as certain parameters that have been talked on the left side of the screen. And it helps to calculate the risk of heart disease in the next 10 years. So you yourself, if you have all your values for your screening test, this one is a good calculator to look at for individuals without a diagnosis of heart disease. I'll also be sharing this diabetes handout, which on the left-hand side, which gives you the criteria for diagnosis of pre-diabetes, diabetes, mellitus based on 3 recommended tests by American Diabetes Association. And if someone has type 2 diabetes mellitus, what would be their goals before meals or 1 to 2 hours after a meal? Who should be screened? Literally anyone in this room, I think, should be getting a screening, but American Diabetes Association recommends it for individuals who are at risk, and those are listed here. And for anyone without any risks, if you're 35 or above, get it done. Okay, it's a simple test, and if it's normal, you may just want to repeat it once a year. All right, let's move to the third strategy, is moving, is staying active. Again, going back to our cycle of root cause for insulin resistance, why are we looking at this rise in epidemic for obesity, for prediabetes, for diabetes, for insulin resistance, for heart disease, is because our time devoted in those 24 hours for activity is lesser as compared to the time we are sedentary. It could be, you're driving back and forth, that's included as a sedentary activity also, or sedentary posture rather than activity. So take breaks, move around. And if you feel like you're tired, you don't want to move or you don't want to walk, just move your arms, move your upper body. What's happening is your muscles are contracting. And when they contract, remember we talked about the cells. Your muscle cells are taking glucose as their fuel, as their energy, and that's helping with insulin sensitivity. And there's a direct correlation when I follow blood sugars for our patients on continuous glucose monitor, there is an immediate drop in blood sugars. So even if you're active, even if you're laughing, a good belly laughter is going to utilize your glucose as fuel and help to reduce the blood glucose as well as improve insulin sensitivity because you're using muscles more than what you would normally. Guideline recommendations from both American Heart Association and American Diabetes Association is at least minimum 150 minutes a week of physical activity. And that if you divide it, it's 30 minutes for at least 5 days a week. More the better, yes, but you have to also look at your rest periods, your sleeping period, as well as how much you are contributing out in the world for your purpose and passion. So almost to the end, the quote still is very, very true. An apple a day, truly, I would say, will keep the disease away. You may need a doctor just for screening purposes, and that would be such an amazing way of patient-physician care, where you're not just dealing with disease management, but actually disease prevention for a healthier and happier future. So The American Diabetes Association guidelines I've just attached for you. We've already discussed about it. And these all should be implemented. It's very tailored, it's very individualized. And that's why I think, having the right healthcare team is very essential because the recommendations would be very different for an 80-year-old versus a 40, 50-year-old versus a 25-year-old in terms of physical activity. And the nutrition plan will also be tailored upon the number of conditions or comorbid conditions or sensitivities, food sensitivities, and individual habits. So what's needed is a healthcare system or, having a healthcare team where we are integrating medicine, which is considered as drugs, along with lifestyle. And when I say lifestyle, it's not just about food, it's not just about physical activity, but it's also your sleep, which is your restful sleep. It's also stress management. How do we respond to situations? Because that's going to dictate a lot with how we deal with prevention, we deal with ourselves, we deal with our physical health goals. Mental health is going to be very, very essential, as well as social connection. Interaction with, we are social animals. So that interaction, which is also going to be the right company, is actually going to take us towards the right health goals. So here is where I would almost end. Time for change is now, not in the future. We can never be ready for the future, but we can be ready now. Just picking one option is, today, if you had to sign off, I would say at least start eating, add more fruits to your meals, or start your meals with a good plate of sauteed vegetables or a good wholesome salad or some form of fiber before you eat anything that you've been used to eating. So I literally did not ask you to avoid anything right now, but incorporate more fiber, fruits and vegetables. If you had to take one conclusion from today's discussion. These are some educational resources and recipes. Forks Over Knives has really great recipes if you had to, simple ones. Nutritionfacts.org is by a renowned physician, and it really puts down the scientific data as well as details about every food ingredient that you could opt for. And on the right-hand side, what you'll see is if you're dealing with actual heart disease and if you're thinking about prevention reversal, Dr. Esselstyn has an amazing book, and he actually has conducted clinical trials, which has shown that low-fat, whole food, plant-based meals have a direct impact on prevention and reversal of heart disease. Another great one is going to be a movie, The Game Changer. That's a great documentary. I think it's available on Netflix right now, but you could also watch the trailer on YouTube, which actually walks you through scientific data, as well as it's more of a storytelling about athletes on how low fats and whole foods can actually help you gain health. These are ways to get in touch with me. I am adding more YouTube videos for educational purposes, as well as lots of handouts and PDF versions. So if you haven't signed up for newsletters, feel free to. They are every Sunday, and I'm adding on to all the health education, not just related to endocrinology, but every aspect which could be geared towards prevention. And the website is right here, unifiedendocrinecare.com, or you can follow me on Instagram or Facebook. And I am very, very delighted for your attention.